So we've been talking a lot about face, but a lot of our patients are also concerned by, some body issue, for example, stretch marks, scars, cellulite. So can you do something with the Environ product, let's say for stretch marks?
The nice thing is that if you use high dose of vitamin A, you can get a significant change to stretch marks. Now, the way of getting a high dose of vitamin A is to use cosmetic needling of the skin first, so that you get very much more of the vitamin into the skin. So I would recommend to them more intense needling than usual in the areas that they want to treat with the stretch marks. Use the vitamin A and then see how it goes after, say, 3-4 months. If that has not given them the result that they want, then we can do medical needling, where we have to use anesthetic. And with that, you have to warn them that some people with the more noticeable stretch marks may have to do 3, 4, 5 treatments before they get a beautiful result.
What about cellulite, more diffuse cellulite?
I think we're good at smoothing the surface of the skin. So I'll talk about the surface rather than the cellulite.
Maybe not cellulite grade 3, but
yes, but this orange peel type of skin, oh yes, no, I think that needling is one of the great things you can do for that. You can't expect a dramatic change from skincare alone.
No.
So you must add medical needling to the regime, and I think you can achieve very, very good smoothing of the skin.
There are many skin conditions that are a little challenging to treat, namely, hyperpigmentation could be either because of post-inflammatory hyperpigmentation or solar elastosis, or even melasma, for example, which is very difficult to treat with what we have at our disposal. How could you, integrate Environ products or procedure with these hyperpigmentation disorders?
Well, I'll start off with the easier one, elastosis. For this, we can make significant differences by the facials. Using high dose of vitamin A, vitamin C into the skin, we've seen this time and again, that we can smoothen out skin, make it look much, much less damaged. When we talk about things like acne, like melasma, we've got significant problems here. I think these are the more or less the search for the perfect product is ongoing. I went to an international conference on pigmentation, and the guy who came to lecture to us, Professor Go, said, "You're all expecting me to say this is how to treat." He said, "But I'm going to teach you one thing. Pigmentation cannot be cured or treated." He thinks that 60% lightening is sufficient. I have a personal view that we need to get more than 80% lightening. I do know that with some products that we are busy working with right now, that we are getting way over that. I think that cosmetic needling of the skin has to happen all the time. When you're treating difficult problems like scarring, like stretch marks, like pigmentation, you have to include enhanced penetration through needling daily.
For acne, I know that Environ has a very interesting line called the Beta Active line, and I've been using on a very regular basis on some patients. It works wonderfully, and it's still vitamin A, that's the active ingredient in the Cellugel A. But so you would recommend to combine, for example, with other procedures, other
that's right.
Okay, for to increase the penetration of the product.
And then I still recommend treatments with blue light, for example, for people with acne. It's worth doing.